Welcome back our fans. Temporomandibular joint disorders. Temporomandibular articulatory system. Temporomandibular joint. Masticatory and accessory muscles. Occlusion of teeth. Extracapsular ligaments temporomandibular. Articulatory system. Temporomandibular joint. Masticatory and accessory muscles. Occlusion of teeth. Extracapsular ligaments. TMJ anatomy. The TMJs are bilateral, diarthroidal ganglioid. Synovial and freely movable. Diarthroidal, the joint has two articulating bone components, the mandibular condyle inferiorly, and the articular eminence and glenoid fossa of the temporal bone superiorly. Ganglioid, the joint has a hinge-like movement component. The joint is lined by synovial membrane and freely movable components of the TMJ. I, the mandibular condyle. 2. The articular fossa and eminence. 3. The disc, meniscus. Soft tissue component. I. Temporomandibular joint capsule. 2. TMJ joint ligaments. 3. Synovial lining. 4. Accessory ligaments of TMJ. V. Muscles of mastication. Glenoid fossa. Articular eminence. Condyle. Separating disc. Joint fibers. Capsule. Extracapsular ligaments. The TMJ articulation consist of I. The condyle. The shape of the condyle varies greatly from one individual to another. Superior surface may be flattened, convex, angle, rounded. Its articular surface is covered by collagenous, non-vascular non-innervated connective tissue. Its anterosuperior part is covered by thick fibrous tissue. 2. The articular fossa and eminence. The receptacle of the condyle is the articular fossa, which is a part of the squamous temporal bone. The squamous temporal bone forms both the concave articular fossa and the convex articular eminence. The articular fossa, glenoid fossa, is bounded medially, laterally, and posteriorly by bony ridges which limit gross displacement of the condyles in these directions. 3. The disc, meniscus. The disc divides the joint space into an upper compartment and a lower compartment. It is a pear-shaped fibrous tissue band that suits the articulating bone surfaces. The apex of the disc projects anteriorly, the posterior part is rounded and encloses the articular surface of the condyle. The anterior part of the disc extends forward in front of the condyle in relation to the articular eminence. The disc is functionally adapted to the high mobility of the joint. Function of the disc. The disc normalizes changes in the intra-articular space during chewing, promotes lubrication, energy absorption, and it permits joint range of motion. The posterior part of the disc is known as bilaminar zone. It consists of upper stratum which is attached to the posterior wall of the glenoid fossa and the squamotympanic suture. The lower stratum is attached to the back of the mandibular condyle. The articular disc is attached to the medial and lateral poles of the mandibular condyles by a non-elastic CT ligaments, known as collateral ligaments. They do not stretch but permit only slight lateral movement of the disc against the condyle. Function of the collateral ligaments. 1. Maintain the contact between the disc and different parts of the condyle. 2. Allows the disc to follow passively the movement of the condyle. 3. Prevents bodily displacement of the disc away from the condyle. Thanks for watching. Support us by likes and subscribes.